Hello, friends. I'm David Katz. Great to be with you. I appreciate the opportunity. And I was invited to talk about what health is for. And I want to say how I think that links to the flight of hope, mine and perhaps yours as well. This issue of what health is for is something I started talking to my patients about over the years, because all too often health comes across as a moral imperative, something someone else tells us we should do. It's at the end of an admonishing finger. This doesn't tend to work very well. This is quite divisive. And I would argue that this division contaminated our pandemic response. Essentially, humans are prone to behave like blocks of flotsam, subject to Newtonian laws for every action, an equal and opposite reaction. So if dogma comes at us from one direction, we tend to gravitate to an opposing corner. I think really this has been very costly to the world in terms of pandemic response. I weighed in early here, suggesting that we needed to look both ways before crossing a busy pandemic, that the direct effects of SARS-CoV-2 on lives was critically important, but the effects of pandemic response policies on livelihoods also important, because life is for living. We needed to respect both and focus on minimizing total harm. I think we could have done that, and I don't think we did. And it's not clear to me we've learned those lessons yet. And I think those lessons reverberate far beyond pandemic response. But certainly it's been a bracing experience dealing with the pandemic, something that I've done in many different ways. I had COVID last January. I've had long COVID, just barely recovering from that. And I did serve on the front lines during the surge in New York City. So I've seen this every which way. And I still maintain, if we had been more willing to listen to one another and think about what health is for, there could have been more common cause on common ground, and we could have done a much better job minimizing total harm. I also think this notion of what health is for pertains to everything else that matters. Our food is killing too many of us. Diet is the single leading indicator of premature death in the United States today and increasingly around the world. Who wants that? Who wants loved ones to be at risk of premature death because of the quality of their diet? And so this isn't about you should eat a particular way because someone says so or because you need to be thinner. This is about protecting people we love. Everyone can relate to that. Similarly, most of us are pretty partial to this planet, and our diet is cooking the planet too. If we socialize this concept and create opportunity for people to engage, more common cause on more common ground. Right now, what we're doing is converting pristine rainforest into ground beef. It's the global demand for hamburgers that's responsible for the accelerating destruction of the Amazon, first and foremost. This needs to be fixed, but first we need to create awareness. And I think if we talk about health, we've got to mean healthy, vital people on a healthy, vital planet, because when we consider what health is for, that's the only way to get there from here. At the True Health Initiative, we're currently working on developing a global 1-week coordinated boycott of beef to protest the raising of the Amazon. Learn more at truehealthinitiative.org. I hope many of you will join us. We're very fortunate as we focus on diet and health and everything that health is for, that we can operate in the sweet spot. Health and environmental impacts of foods are highly confluent. The same foods that are good for one, fruits, vegetables, whole grains, beans, lentils, nuts, and seeds, are good for the other. And so the sweet spot, dietary patterns, better for the environment, better for health, and by the way, kinder and gentler to our fellow creatures. This is a message that I think could and should reverberate widely if we can overcome the dogma and talk more about the aspirational elements of what health is for and less about the reasons why people should do what we say. Better for us, better for the planet, better for our aquifers, kinder and gentler to creatures wild and domestic. I believe Dr. Benjamin will also invoke this quote, which I love: the best way to predict the future is to create it. I believe Abraham Lincoln tweeted this. And I'm pleased to say there are many great efforts creating the kind of future where health can be all that we want it to be. One that I like very much is the Planetary Health Alliance, founded by Dr. Samuel Myers at Harvard. They have a terrific book, Planetary Health. And Sam is also the principal architect of the Sao Paulo Declaration, creating opportunity for diverse constituencies to engage in protecting planetary health. Food and Planet is a new nonprofit devoted on educating dietitians to focus on the confluence of diets good for people and good for the planet, because there are no healthy people on a ruined, uninhabitable world. And I've long admired the work of Daniel Nierenberg at Food Tank. These are all great efforts working to create the kind of future we would all like to predict, where everything that health is for is realized and fulfilled. And I think all of this pertains to the flight of hope, because we've been living through difficult times, and we need to retain our hope that better is possible if we are to maximize our efforts working in that direction. Hope is the thing with feathers that perches in the soul and sings the tune without the words and never stops at all. And sweetest in the gale is heard, and sore must be the storm that could abash the little bird that kept so many warm. I've heard it in the chillest land and on the strangest sea, yet never in extremity it asked a crumb of me. Whether hope asks a crumb or not, I think it does need to be nourished. And I think our collective efforts are exactly that, sustenance for one another's hope. And working together in common cause, on common ground, and fulfilling that hope, we can achieve everything that health is for. Thank you all very much.